This is Courtney Coons at Graham Regional Medical Center, and today I will be demonstrating two enhancements related to the home medication list in Meditech that nurses will see once the system comes back up after our scheduled downtime on the morning of October 30th from 3 to around 8 a.m. So once nurses are back into the system, you'll see a couple of changes on the home medication list entry area. The first is called reason for use. This is the reason a patient may be taking a medication. It is not required to document this. However, if you would like to enter this information, you can click on the drop down arrow and select a reason the patient may take the medication. You also have the option to type something in. If you do not see a common reason on the list, you can free text this information. The key here is to click enter on the keyboard when you're done instead of clicking out here in the green space. So clicking enter will place whatever you typed into the field. Okay, that is how you document reason for use. Reason for use will not be there if you have charted that this is a PRN medication. The field actually changes to PRN reason, which is required. And this is your typical list that you've previously seen. Nothing related to PRN and PRN reason has changed. Just the new field of reason for use when it is not a PRN medication. The second enhancement nurses will see is related to the last taken. So if I say I know a date and time the patient last took the medication, previously the only thing you were able to chart was the actual date and time the patient last took the medication. Now when you click the drop down arrow, you have some shortcuts. So I can say 1, 2, 3, day, week, month, year. So an example may be 2 weeks ago or 1 year ago. I also have the option to click on the keypad and maybe pick a value such as 5 that's not listed here and say 5 months ago. And then of course I still have the ability to select calendar, pick a day on the calendar, a date, and enter a time the patient last took that medication. So that is a enhancement, some shortcuts related to last taken. There's also some shortcut keys. You could say 1 space D, enter, and that will give you 1 day ago. Or 5 space W would be 5 weeks ago. Maybe we do 3 space Y for years ago, and 1 space M for 1 month ago. So again, these are two enhancements for Meditech that nurses will see related to the home medication list. They will not be there until after the downtime scheduled for this Thursday, October 30th, 2014. If you have any questions, please contact Courtney Coons or Francis Vieira in the Clinical Informatics Department. Thank you.